Hello everybody, my name is Mona Chisoe Jiogu, but I go by Mona. Today I'll be talking about one of my clinical encounters. I'll be talking about the one of the patients I encountered last week and the treatment modality that was used for this patient. So I'll be talking about this lady. I'll be using X to represent that patient. So this patient X has a child. She's a single mother. So she has a child that recently fell sick. So she's like the all and all of this child. She's the one that looks after the child and all that, and she lives far away from her family. So she has got this recent job. She said she's a registered nurse. She got a job. So you found out that there's job stress, and she's like a newly qualified nurse. Like she just graduated from the university and just started her career. So like I said, she had like a 2 year old child that was really like the child was on and off the hospital, and this lady has just got a new job. Like she was trying to like fit into the job, trying to like transit from a student to a nurse. So like the struggles, the coping, all the things. So she's like a kind of like she's really down, like trying to balance her life with her career, trying to balance her family, trying to be there for her child, as well as also to earn an income to look after herself as well as her child. So this lady, this thing, according to her, so she said the child was born with a congenital disorder. She is a smoker. So all these things are like really weighing her down, because like she can't really like progress so much. She can't do so much for herself, look being like a full-time carer for her child, and also like being like the primary income earner for her family. So she's been like a kind of anxious, because if she decides to like quit her job to look after her child, she's like super anxious about how is she gonna feed, how is she gonna cope with her bills, things like that. How is she gonna look after herself? Also, the child's problems, the child's clinical problem is also like making her depressed, because she doesn't really know like should she give, like what if her child dies. She's really like struggled so much with her child to this point that so she doesn't know how to like jungle all these things. She doesn't know how to like mix all these things. So she has this recurrent thoughts in her mind, like this anxiety kind of thought, on and off, on and off. What if you lose your job trying to look after your child? What if you look after your child? So she came to our clinic. She came to our clinic for a psychotherapy session, so we could help her find a way to like be able to live like a balanced life, be able to cope with all these things going on with her. So one of the treatment strategy that was used for this patient was the cognitive behavioral therapy. So in cognitive behavioral therapy, what is normally done is to explore the negative thoughts of patients. So for this patient, we had to like explore like the negative thoughts. What are those negative thoughts that comes to her? The thought of hopelessness, the thought of helplessness, all those negative thoughts that comes, like probably your child is not gonna make it, probably you're gonna be sacked from your job. We're gonna like, what we did was to explore those thoughts. After exploring those thoughts, we try to replace those negative thoughts with positive thinking. Whenever she remembers those thoughts, or whenever these thoughts comes into her mind, she tries to replace them, or try to use good examples to replace them. Hey, my child is going to be healed. My child is going to pass through these stages. These are the stages of single parenthood. Like she's going to like remember positive thinking, replacing the negative thoughts with the positive thoughts. So also regarding her job, we try to like make her like have positive attitude, positive thoughts, replace it with also the negative thought. So in as much as we try to like do these things, we also like strategized. We try to talk her into like going into like the PRN job role as soon as she completes her orientation phase. Being a PRN will help her to be able to look after her child, to have more time to look at after her child, and also help her to she will earn more than the permanent employers, and also that will also help her to have more money to look after herself as well as her child, who needs also who will also need financial aid or financial help. So talking about the diagnosis, so the diagnosis was major depressive disorder, because most times she's a kind of depressed, she's hopeless, she's always having these negative thoughts like things are not going to work out fine. So that was the diagnosis for this client. So, talking about the role of motivational interviewing in this client, motivational interviewing is really going to be very beneficial in this scenario, because it will help me to explore what the patient is experiencing. It will help me to like explore this patient's values, priorities, and align them, and help her to align them to make things work. It will help me to like using active listening, which is one of the components, or one of the things that are important in motivational interview. I'll be able to know about the patient's frustrations, I'll be able to know about the patient values, I'll be able to know about the patient priorities, I'll be able to acknowledge as in the most important things they are talking about. Also, motivational interview has to do with the use of open-ended questions. If using open-ended questions, I'll be able to explore the patient's ideas, I'll be able to explore the patient's opinions and things like that. So I'll be able to explore the patient's opinions, whatever. Like, it will give me room to know this patient more and what is going on in her life. Also, affirmation is a component of motivational interview, because it will help me to affirm, it will help me to acknowledge, it will help me to like support the positive positive actions that will lead to good life. It will help me to affirm her support, to affirm her energy, to affirm her support, to affirm the positive things she's doing for herself as well as her child, and also affirm to affirm her job situations, things going on, positive good things going on in her job situation. Talking about my comfort level with motivational interviewing, I'm very okay. I'm very comfortable with motivational interviewing, because it helps to like explore patients' thoughts, opinions, values. Like, because using an open-ended questions, like when you throw an open-ended question to a client, it will help you to like know more about this patient rather than a yes or no questions. Also, the act of active listening of motivational interviewing is very important, because you get to like actively listen, get involved with what the patient is saying, pay active attention to what the patient is saying, acknowledge what they are saying, and work towards it. So also motivational interview has to do with reflective thinking. As you are conversing with this patient, you're having like a reflective thought of what is going on, like what you are interviewing. It's also like I like the affirmative part of motivational interviewing, because it will help you to affirm the positive acts of the patient, trying to affirm, trying to acknowledge what they are doing right. So in my day-to-day practice, knowing what motivational interviewing is all about, it will help me positively to meet the needs of my client. It will help me positively to know my client and to know what action plan I'm going to create for them. Working motivational interviewing combined with cognitive behavioral therapy is very effective in treating clients with depression, such as this client I encountered last week during my clinical encounters. Thank you so much.